Hello, Mama Angeles. We're moving to the next stage of the pandemic, and as the world resets to the new normal, we find ourselves seeking the right balance between health and livelihood, constantly adjusting the boundaries between liberty and responsibility. Welcome to Asean in Focus on today's headlines. The Department of Foreign Affairs, through the Office of the Undersecretary for Migrant Workers Affairs, has already reached out to the next of kin of the two overseas Filipino workers who died from the explosion in Beirut, Lebanon. And 10 of the 11 Filipino missing seafarers have been found safe and accounted for following the deadly explosion that struck the Lebanese capital of Beirut. The COVID-19 pandemic has created the largest disruption to education in history, and prolonged school closures could further entrench inequalities in access to learning, according to the UN chief. The ASEAN Secretariat gathered a panel of global experts to share their views on the impact and responses to the COVID-19 pandemic and discuss policy insights towards a post-pandemic recovery. The Department of Foreign Affairs, through the Office of the Undersecretary for Migrant Workers Affairs, has already reached out to the next of kin of the two overseas Filipino workers who died from the explosion in Beirut, Lebanon. Since December of 2019, the department has already repatriated 1,508 Filipinos from Lebanon, and there are still currently around 31,916 Filipinos in Lebanon. The department assures the public, as well as all the other Filipinos in Beirut, that it shall provide all the necessary assistance to the Filipino victims of this terrible tragedy. Likewise, the department continues to coordinate with the Lebanese authorities in locating the reported missing Filipinos. Lebanon is already in mourning after a huge explosion in the capital, which devastated the Beirut port and damaged many streets and buildings well beyond. The death toll from the explosion has now climbed to 135 and more than 4,000 injured, according to a minister. It began just after 6 p.m. Tuesday local time when a warehouse housing ammonium nitrate left unsecured caught fire. The blast left the Lebanese capital resembling the scene of an earthquake. Thousands of people left destitute and thousands more cramming into overwhelmed hospitals for treatment. Take a look.
May iyak kasi mamaya ano tong kamay ko medyo na hindi pa kasi ito natahi. Ito kasi talaga yung malakas ang ano talaga.
Opo. Sige po, palakas po kayo ha. Ingat po kayo.
Oo, mayangat lang kasi may pag-uya tayong nurse.
Opo.
Tawag na lang ulit ang message.
O sige po, salamat po.
Anong na-damage sa'yo?
Ito.
Oh.
Ito ba? Salamin kasi ang nakaano nito.
Nasugatan ka ng salamin?
Salamin. Tapos dito sa part na ito ng bandage yan. Puro salamin lang.
Sa ulo, wala naman?
Wala naman. Tapos yun dyan sa paa ko. Tingnan sa paa ko. Ayan. Yung bandage na yan.
Yaharang. Sa'yo.
Hindi pa naman inano kasi kailangan dapat pag pinahin na lang ito. Kailangan dapat na-move. Kasi kailangan.
Asan na yung madam mo? Wala pa?
Yung madam ko nag-travel siya, pero yung assistant niya lang pumupunta dito na talagang nagbabantay lang dito.
Tapos?
Ayun. Nag-usap naman
Buti mayroong nakapag-rescue sa'yo. Papunta dito.
Buti nga na talagang loob talaga. Nung nandun pa kami sa Asrape talaga. Talagang...
Ay, sa Asrape ka? Akala ko sa Asmiye ka.
Asrape kami na ano. Yung nakita mo yung sumabog na mga sa logistic, umabot dun sa bahay namin.
Pero wala naman daw internal na damage?
Wala naman. Tapos pinaradyo nila ako lahat.
Wala naman, normal naman.
Talagang nagla-lockdown talaga yung ano ko talaga. Kasi parang gusto ko talaga matulog talaga eh. Pero sabi ng mga nurse, huwag ka matulog. Sabi niya,
pigilin mo. Kasi nga,
Pero talagang hindi ko talaga kina-assist kaya tinakbo ko dito sa ICU.
Yung asawa mo nagme-message, ginamit niya yung...
Nag-usap na kami kanina sis kasi talaga yung talagang minisid niya lahat.
Pero okay ka na ngayon.
Okay na sis.
Salamat sa Diyos.
The country's hospitals are also struggling with the coronavirus outbreak, with many experiencing shortages of personal protective equipment and ventilators. The resulting footage, widely shared on social media, shows a ball of fire and smoke rising above Beirut and a white shockwave engulfing everything around it. The mushroom-shaped explosion, which seismologists said was logged as the equivalent of a 3.3 magnitude quake, and the scope of the damage drew nuclear analogies in many people's accounts of this tragedy. Already heavily strained by the COVID-19 crisis, Beirut's hospitals were overwhelmed by casualties in need of urgent treatment. Authorities estimate 300,000 people will be left temporarily homeless. Beirut Governor Marwan Aboud said the estimated cost of the damage from the explosion was between $3 to $5 billion. Lebanon's president has announced 3 days of mourning and promised to release 100 billion lira, or $66 million in emergency funds. The country's president, Michel Aoun, said that over 2,700 tons of ammonium nitrate have been stored in a warehouse unsafely for 6 years. And the government announced a 2-week state of emergency. The Lebanese government on Wednesday said it wanted officials placed under house arrest over this cataclysmic blast. Several countries have offered their help. This tragedy comes at a critical time for Lebanon. The country is also reeling from its worst economic crisis in decades. Meanwhile, 10 of the 11 Filipino missing seafarers have been found safe and accounted for following the deadly explosion that struck the Lebanese capital of Beirut on August 4. In an advisory on Wednesday, the Philippine Embassy in Lebanon said the 10 suffered minor injuries and are now with the management of the shipping company Abu Meri Cruises at Ain El Merais, Beirut. The 10 are among the 13 Filipino seafarers on board the Orient Queen Cruises, whose ship was docked some 400 meters away from the blast zone. Now, this latest development leaves one seafarer and one Filipino domestic worker still missing after the explosion. At the same time, it reported that all its embassy personnel are safe with no reported physical damage in its premises. 2 Filipinos were confirmed killed in the incident, while 8 were injured. 2 of the wounded are currently recuperating at the embassy chancery after receiving treatment from a hospital. Meanwhile, the Department of Foreign Affairs said it already reached out to the next of kin of the blast victims. The department assures the public, as well as all the other Filipinos in Beirut, that it shall provide all the necessary assistance to the Filipino victims of this terrible tragedy. Likewise, the department continues to coordinate with the Lebanese authorities in locating the reported missing Filipinos. In Malaysia, new COVID-19 cases surged to 21. Joining us live is Gail Aldos. Hello, Gail.
Hello, Alma. Good afternoon.
Afternoon.
Here is the latest news. After recording just one case yesterday, Malaysia yesterday saw a surge in COVID-19 with 21 new cases, 15 of which are imported infections involving Malaysians, said Health Director General Datuk Dr. Nur Hisham Abdullah. He said 6 of the new cases were local transmissions involving Malaysians, including 3 from the Sivaganga PUI cluster in Kedah. He said in a statement, the other 3 local transmissions comprise 2 in Sabah, 1 pre-surgery screening at Hospital Queen Elizabeth, and 1 pre-procedure at the Sabah Women's and Children's Hospital, and 1 pre-operation screening at Hospital Sultana Amina in Johor Bahru. He said the number of positive cases in Malaysia now stands at 9,023, including 196 active cases with infectivity. A total of 18 cases were discharged yesterday, bringing the cumulative figure for recoveries to 8,702, or 96.4% of the total number of cases. Dr. Nur Hisham said 2 cases were being treated in the ICU, but none required ventilator support. He said no further fatalities were reported and the death toll stays at 125, or 1.385% of the total number of cases. Elaborating on the 15 imported cases, he said the infected Malaysians had returned from Yemen, which consists of 12 cases, and 1 each from Papua New Guinea, Ivory Coast, and the United Kingdom. He added that all of the imported cases are in the federal territory of Kuala Lumpur, and they have been isolated at quarantine centers after arriving at the KLIA. Therefore, they do not pose an infection risk to the local community. On developments at the Sivaganga PUI cluster, Dr. Nur Hisham said so far 1,647 people had been screened in the cluster and 24 were found positive, 754 negative, and 869 are still awaiting the results. On the three new cases in the cluster, he said they were second-generation infections detected through screening of close contacts of positive cases. Two of the new cases are the children of case number 9,000. One of the children suffered respiratory tract symptoms on July 30th but did not seek treatment at any health facility. Meanwhile, the third case, case number 9023, a close contact of case number 8976, came with fever and respiratory tract symptoms on August 2 and was treated at the Taman Selassie Health Clinic in Kulim. Dr. Nur Hisham said a viral message on the third case containing details of the places allegedly visited by the patient was false and the public should not share it. Back to you, Alma.
Right. Gail, also, Malaysia and Singapore will reopen or will begin allowing limited cross-border travel between the two countries soon. But with the ongoing pandemic, will there be prerequisites for Malaysians to enter Singapore and vice versa?
Yes, Alma. Malaysia and Singapore will begin reopening the borders between the countries from August 17. This will be for selected travelers under the Reciprocal Green Lane or RGL and the Periodic Commuting Arrangement or PCA travel schemes. The RGL enables short-term travel for official purposes and essential business for up to maximum of 14 days stay. The PCA scheme allows the entry of residents of both countries who hold valid work passes. Both travel schemes incorporate strict health and visa protocols such as mandatory pre-departure COVID-19 test and self-quarantine upon arrival. To enter Singapore, under the RGL scheme, visitors will need to obtain the Safe Travel Pass, which is a mandatory document for all inbound travelers entering the country. A Singapore-based company or a Singapore government agency will apply on the applicant's behalf. Another requirement is that the traveler must ensure they have not left Malaysia in the last 14 days prior to departure and must have a negative COVID-19 PCR certificate issued no more than 72 hours prior to their departure. Only certificates issued from laboratories accredited by Malaysia's Ministry of Health will be accepted. The approved applicant will need to submit an electronic pre-trip health and travel history declaration via the SG arrival card. Travelers taking flights are only permitted to take non-stop flight routes to Singapore. Upon arrival in Singapore, travelers will be subjected to home surveillance order and quarantine for 7 days, at the end of which they undergo a COVID-19 PCR test. The traveler will bear the cost, which is around 200 Singapore dollars, around 143 US dollars per person for COVID testing. The travelers should also install the Trace Together application, which is designed to support the government's contact tracing capabilities. Now, to enter Malaysia under the RGL scheme, travelers must first obtain the My Travel Pass, similar in purpose to the Safe Travel Pass issued in Singapore. As with Singapore, only a Malaysian-based company or a Malaysian government agency can apply on behalf of the traveler for the My Travel Pass. All applicants must ensure that they remain in Singapore at least 14 days prior to departure to Malaysia and have a negative COVID-19 PCR certificate, which was issued at least 72 hours before departure. And upon arrival in Malaysia, the travel will be subjected to another COVID-19 PCR test at the port of entry at their own cost and will need to download the MySejahtera contact tracing application. Back to you, Alma.
All right, very strict protocols for travelers now, right? All right, thank you very much, Gail, for your updates there in Malaysia. Thank you, EBC Kuala Lumpur, Malaysia Bureau.
Thank you, Alma. Reporting live from Kuala Lumpur, Malaysia, this is Gail Aldas. We live in interesting times.
And Vietnam rolls out hydroxychloroquine, and uses convalescent plasma for treatment of COVID-19. Here's Ralph Wandolph Empire.
Vietnam has completely halted the use of hydroxychloroquine, the controversial anti-malaria drug touted by U.S. President Donald Trump in its treatment of COVID-19 patients, and instead opted for plasma from recovered cases. The information was announced by Nguyen Van Kin, former director of the National Hospital for Tropical Diseases and chairman of Vietnamese Society of Infectious Disease, as he discussed the latest revision of the Health Ministry's COVID-19 diagnosis and treatment guidelines. The fourth comprehensive update since the coronavirus cases were first recorded in Vietnam in late January. The Health Ministry noted that while there had not been a definitive drug to treat COVID-19, a variety of antiviral drugs, including the domestically available lopinavir, ritonavir, and interferon, might deliver some results as many patients were cleared of the virus within a week. The U.S. made and not readily accessible remdesivir, along with pyravir, commonly used in Russia, were also noted as promising by the guidelines. Hydroxychloroquine and chloroquine are no longer used as their effectiveness in dealing with the disease were not ascertained. But the antibody-rich plasma from recovered COVID-19 patients is now considered a solid substitute for antiviral drugs. In the latest guidelines, Keane said that the health ministry had clarified SARS-CoV-2, the virus that causes the disease, is not just attacking the respiratory system, but also causes problems in all internal organs. Doctors treating COVID-19 cases should also pay attention to risk of cytokine storm, a syndrome in which the body's own immune system goes into overdrive in response to the infection, mistakenly destroying other cells of the body in the process, leading to organ failures and other severe damage. One of Vietnam's most critically ill cases, the otherwise healthy 43-year-old Scottish pilot, spent 2 months on life support due to this syndrome. Patients will be categorized into 5 levels for treatment, with the first level comprising those having no symptoms and progressing in terms of severity of respiratory issues to the 5th level, where the patient is in critical condition. Blood oxygen drops below 92%. They suffer organ failure and other complications such as septic shock, infections, or pulmonary infarction. Regarding children who contracted COVID-19, in the new treatment guidelines, doctors are told to look at possible multi-organ inflammatory lesions similar to the rarely occurring Kawasaki disease, with an array of symptoms including fever, erythema or corneal hyperemia, or submucosal swelling, circulatory failure, heart damage, and blood clotting disorder. In the latest guidelines, mental therapies with the aim of enhancing optimism for the patients were stressed for the first time. Keane said that medical centers should test the patients 3 times, each 24 hours apart, before discharging them. The recovered patients are required to be isolated at their homes for another 14 days after release. Keane cited a case where a patient during the 14-day isolation after being declared clear of the virus had tested positive for the virus again. With this new item, the current criteria for hospital discharge include no fever for 3 days, no clinical symptoms, 3 negative tests in 3 consecutive days, and further medical observation during the 14-day home isolation. Keane also warned that those who have tested negative for the virus using quick test methods should still be staying at home in isolation for 14 days. If they have either gone through virus-hit regions, suffered from some COVID-19-like symptoms, or had contacts with confirmed patients. The latest guidelines instruct the medical centers to conduct the more time-consuming but accurate real-time RT-PCR diagnostics of all suspect COVID-19 cases to avoid missing out on patients. Specifically, cases of fever, cough, and acute respiratory infection that cannot be explained and without epidemiological factors, returning from an outbreak area, exposure to confirmed COVID-19 cases or suspected cases will all be tested. This is Ralph Fondel Empire bringing you the latest updates here in Vietnam. We live in interesting times.
Thank you, Ralph. The Department of Foreign Affairs reported 49 new recoveries among Filipinos with COVID-19 in the Asia-Pacific, Europe, and the Middle East, Africa, raising the total to 5,730. However, 20 new infections were also added, including 2 new fatalities in the Middle East. In its latest case count, DFA said the overall tally now stands at 9,627, while the death toll is at 695. Earlier, Foreign Affairs Undersecretary Brigido Dulay also confirmed the first reported Filipino national to die of COVID-19 in Libya. 3,202 Filipinos are still undergoing treatment across the globe, 260 in the Asia-Pacific, 504 in Europe, 2,298 in the Middle East, Africa, and 140 in the Americas. Now, Vietnam cases, coronavirus cases, are predicted to reach its peak in the next 10 days. We have an update coming in from Chriselle Lacuna. Hello, Chriselle.
Hi, Alma. Good afternoon to you.
Good afternoon. Go ahead,
Yes.
Chriselle.
COVID-19 situation in Vietnam forecast to reach its peak in the next 10 days. The COVID-19 pandemic in Vietnam will likely reach its peak in 10 days. Deputy Minister of Health Win Chong-sun warned on Wednesday, reminding that people should take precautions and strictly follow recommendations for COVID-19 prevention. He informed that drastic tracing and isolation efforts are being carried out. As of 6:10 a.m. on Thursday, the nation's patient tally reached 717, including 268 new cases reported since the emergence of the COVID-19 outbreak in the central city, according to the National Steering Committee for COVID-19 Prevention and Control. The patient tally includes 381 recovered cases and 9 deaths, said the steering committee. Another update, Alma, 45 illegal foreigners detected in southern Vietnamese province. Authorities in the central Vietnamese province of Can Hoa have discovered 45 foreigners who had been staying in the locality without identification papers or expired visas. Officers under the Provincial Department of Police confirmed on Tuesday they had recently inspected 80 accommodation facilities in Can Hoa and found 45 foreigners who had been staying there illegally. Among them, 25 were unable to present legitimate identification papers, which indicated they had entered Vietnam against the law. The other 20 foreign citizens were holding expired visas. Most of the illegal foreigners are Chinese, while the others are Russian nationals. Win Dak Tai, Vice Chairman of Can Hoa People's Committee, ordered competent authorities to continue examining local accommodation facilities to promptly detect similar cases. And I quote, "Under the direction of the Prime Minister, those who organize for people to enter Vietnam illegally will be criminally charged. Foreigners who enter Vietnam illicitly or stay in the country against the law must undergo medical examination and epidemiological investigation before being sent back to their home country," end quote, Tai asserted. And for the weather update, Alma, rain is expected to dampen Vietnam's northern, southern, and central highland regions in the next couple of days, according to the National Center for Hydrometeorological Forecasting. In Hanoi, rain accompanied by strong gusts and lightning is in the forecast starting from Wednesday to Saturday this week. Meanwhile, a strengthened monsoon is also expected to bring downpours, thunderstorms, and strong winds to the central highlands and southern Vietnam, including Ho Chi Minh City from Wednesday to Friday. Average temperatures will range from 23 to 32 degrees Celsius in the southern metropolis on Thursday. So far, that is the update from Ho Chi Minh City. Alma?
Thank you very much, Chriselle, for your updates there. Looking forward for more. Stay safe, stay healthy.
Thank you so much, Alma. From EBC Vietnam Bureau, this is Chriselle Lacuna We live in interesting times.
Thanks, Chriselle. Staying in Vietnam, in the central Da Nang city, it has been racing against time since August 2 to convert a sports complex into a 2,000-bed makeshift hospital to treat COVID-19 patients. Take a look. Now, the installation of beds and basic equipment was completed on August 5. The city has reported more than 180 coronavirus cases since July 25. It also recorded its first coronavirus death last July 31. Almost all of the new cases were linked to the central tourism hotspot of Da Nang. And to date, according to data compiled by Johns Hopkins University, 8 people in Vietnam have died as a result of COVID-19. The communist nation was applauded earlier this year for controlling COVID-19 with strict restrictions on movement, extensive quarantine measures, and a robust track and trace regime. But an outbreak over the weekend in the beach resort of Da Nang near Hoi An has put the country back on high alert. And further actions are taken to prevent a second wave of virus infections. Joining us from Australia, or reporting from Australia, is Justin Vicente.
Came into effect as well. Australia was widely heralded as one of the countries in the world seeming to be at the brink of eliminating COVID-19. After many weeks of flattening the curve, hundreds of new cases have occurred every day within the last week. Each day, there have been up to 723 new confirmed cases and counting, therefore posing a possible second surge of the global known infection within this country. New South Wales is one of Australia's most populous states and has had up to 21 new cases every day within the last week. Tighter restrictions on cafes, restaurants, weddings and funerals came into effect, as well as mandatory mask wear for healthcare providers. The immense growth in the number of COVID-19 cases seen in another state, Victoria, which has had between 300 to 700 new confirmed cases every day within the last week, has alerted New South Wales Health Government to take further action towards containing the virus.
To be honest, when it was first starting, it was a little bit scary, especially when you're serving customers and there's cases in the center, and when customers coughing and just doing all that kind of stuff, it makes you a bit nervous because you can't really go anywhere, right? You have to stay in work and do stuff. So there is a bit, as it kind of calmed down a bit now, it's not as bad, but still it kind of crosses your mind every now and then. So there's definitely that factor there, I'd say.
I think there is a bit of anxiety going on because me being in retail, we've noticed since the outbreak here in the shopping centre, a lot of people now are, withdrawing from coming here because of that one incident. So, I think there is a lot of anxiety out there in
thoughts. It is a little scary, I would say, just because I feel like with the second wave, there's so many more cases than the first. And you just don't know anymore. It's hard to go out just because you never know, you could get the virus in 2 seconds.
In a bid to eradicate a second wave of the infection, the New South Wales Health Government escalates to moderate risk level amber for local transmission of COVID-19. As part of the restrictions in place, all healthcare workers are required to wear surgical masks if they are within 1.5 metres of patients or visitors. Inpatients and visitors should also be provided masks to be worn. After announcing the new restrictions last week, New South Wales Premier Gladys Berejiklian said the measures would reduce the risk of community transmission and help authorities control the virus. While some people agree to the terms of mandatory mask wear, others seem to differ in opinion.
Honestly, I'm all for the mask because, it's all about keeping the community safe, especially the elderly and the most vulnerable. And if wearing a mask helps that, then I'm for it 100%.
I respect people that don't have them, but would most likely prefer because it's safety not only for us, but for other people as well. And I feed a family of 4. So if I don't wear masks and I get sick, I can't provide for them because I can't come to work. So I think I prefer for them to wear masks because of our condition right now.
For me, honestly, I wish I could wear a face mask, but sometimes not a requirement for us anyways. But when I do see a customer wearing a face mask, it makes me feel much more relieved that they are wearing a face mask. So Yeah, I definitely think that everyone should be wearing face masks.
Although the rules in New South Wales regarding masks are applied for those within clinical areas, it is predicted that if the number of confirmed cases continue to rise, tougher and further restrictions may take place for the public in the coming weeks. The New South Wales Health Government urges the public to ensure social distancing is still in place whether people are at work or in the public. Furthermore, they advise that if people are not able to physically distance, wearing a mask is encouraged as it is one aspect of keeping others and ourselves safe. Reporting from Sydney, Australia, Justine Vicente, Eagle News. We live in interesting times.
The COVID-19 pandemic has created the largest disruption to education in history and also prolonged the school closures. And prolonged school closures could also further entrench inequalities in access to learning. That is according to the UN Secretary General, underlining the need for bold steps to address the crisis. Let's listen in.
Education is the key to personal development and the future of societies. It unlocks opportunities and narrows inequalities. It is the bedrock of informed, tolerant societies and the primary driver of sustainable development. The COVID-19 pandemic has led to the largest disruption of education ever. In mid-July, schools were closed in more than 160 countries, affecting over 1 billion students. At least 40 million children worldwide have missed out on education in their critical preschool year. And parents, especially women, have been forced to assume heavy care burdens in the home. Despite the delivery of lessons by radio, television and online, and the best efforts of teachers and parents, education is the key to personal development and the future of societies. It unlocks opportunities and narrows inequalities. It is the bedrock of informed, tolerant societies and the primary driver of sustainable development. The COVID-19 pandemic has led to the largest disruption of education ever. In mid-July, schools were closed in more than 160 countries, affecting over 1 billion students. At least 40 million children worldwide have missed out on education in their critical preschool year. And parents, especially women, have been forced to assume heavy care burdens in the home. Despite the delivery of lessons by radio, television and online, and the best efforts of teachers and parents, many students remain out of reach. Learners with disabilities, those in minority or disadvantaged communities, displaced and refugee students, and those in remote areas are at the highest risk of being left behind. And even for those who can access distant learning, success depends on their living conditions, including the fair distribution of domestic duties. We already faced a learning crisis before the pandemic. More than 250 million school-aged children were out of school. And only a quarter of secondary school children in developing countries were leaving school with basic skills. Now, we face a generational catastrophe that would waste untold human potential, undermine decades of progress, and exacerbate entrenched inequalities. The knock-on effects on child nutrition, child marriage, and gender equality, among others, are deeply concerning. This is the backdrop of the policy brief I'm launching today, together with a new campaign with education partners and United Nations agencies called Save Our Future. We are at a defining moment for the world's children and young people. The decisions that governments and partners take now will have lasting impact on hundreds of millions of young people and on the development prospects of countries for decades to come. The policy brief calls for action in 4 key areas. First, reopening schools. Once local transmission of COVID-19 is under control, getting students back into schools and learning institutions as safely as possible must be a top priority. We have issued guidance to help governments in this complex endeavor. It will be essential to balance health risks against risks to children's education and protection, and to factor in the impact on women's labor force participation. Consultation with parents, carers, teachers, and young people is fundamental. Second, prioritizing education in financing decisions. Before the crisis hit, low and middle income countries already faced an education funding gap of $1.5 trillion a year. This gap has now grown. Education budgets need to be protected and increased. And it is critical that education is at the heart of international solidarity efforts, from debt management and stimulus packages to global humanitarian appeals and official development assistance. Third, targeting the hardest to reach. Education initiatives must seek to reach those at greatest risk of being left behind: people in emergencies and crises, minority groups of all kinds, displaced people and those with disabilities. They should be sensitive to the specific challenges faced by girls, boys, women and men, and should urgently seek to bridge the digital divide. Fourth, the future of education is here. We have a generational opportunity to reimagine education. We can take a leap towards forward-looking systems that deliver quality education for all as a springboard for the Sustainable Development Goals. To achieve these, we need investment in digital literacy and infrastructure, an evolution towards learning how to learn, a rejuvenation of lifelong learning and strengthened links between formal and non-formal education. And we need to draw on flexible delivery models, digital technologies, and modernized curricula while ensuring sustained support for teachers and communities. As the world faces unsustainable levels of inequality, we need education, the great equalizer, more than ever. We must take bold steps now to create inclusive, resilient, quality education systems fit for the future.
ASEAN in Focus will be right back.
Ein sonniger Tag heute hier in Berlin bleiben können. Die sollten wir wertschätzen. Ihnen sollten wir unseren Dank ausrichten. Darum lasst uns noch mehr zusammenhalten. Sie wertschätzen.
Indonesia's coronavirus hit economy contracted in the second quarter for the first time in more than 2 decades, with warnings that its recovery could be among the weakest in Southeast Asia. Output in the region's biggest economy slumped 5.3% on year in April to June, according to the statistics agency, as retail sales and manufacturing took a hit. Now, that marked Indonesia's first contraction since the first quarter of 1999 during the Asian financial crisis, putting it on course for its first recession since then. Economic activity in Indonesia collapsed in the second quarter, research house Capital Economics said in a note after the figures were published. It also said a failure to contain the virus effectively and inadequate policy support means the recovery is likely to be one of the slowest in the region. Governments around the world have been struggling to contain the deadly disease, which forced the shutdown of vast parts of the global economy in the second quarter. Last month, Indonesia's central bank cut interest rates for the fourth time this year in a bid to boost the struggling economy. Indonesia has announced a stimulus package worth more than $48 billion to help offset the impact of the virus, which forced a large-scale shutdown that hammered growth, including in the key tourism sector. Several million Indonesians have been laid off or furloughed, and the government has projected that the economy could contract by 0.4% for the full year. The ASEAN Secretariat gathered a panel of global experts to share their views on the impact and responses to the COVID-19 pandemic. They also discussed policy insights towards a post-pandemic recovery. The high-level dialogue on ASEAN post-pandemic recovery was opened by Secretary General of ASEAN, Dato Lim Jock Hoi, and moderated by Deputy Secretary General for ASEAN Economic Community, Aladin Rillo. The dialogue's panelists consisted of World Bank Managing Director of Development Policy and Partnerships, Marie Pangestu, Asian Development Bank's Vice President for East Asia, Southeast Asia, and the Pacific. Let's listen in.
Engagement, ladies and gentlemen. COVID-19 has also affected the work of ASEAN, while digital technologies have to an extent help us progress our work. They cannot fully substitute the people-to-people connection that is at the core of our community. While we may not know when we can successfully overcome COVID-19, what is certain is that we will be able to get through this. It is therefore important for ASEAN not to lose sight from our community building works and regional integration efforts as we take into consideration the experience and lesson learned from COVID-19. At the recent concluded 36th ASEAN Summit in June, our leader announced a number of key initiatives, including the establishment of COVID-19 ASEAN Response Fund and the commencement of the ASEAN post-pandemic recovery efforts, particularly development of comprehensive recovery framework. Let me quickly draw your attention to the ASEAN Comprehensive Recovery Framework. This framework that we are currently developing will have to be holistic, robust, pragmatic, inclusive, and sustainable. It needs to promote collaborative engagement and contribution for all stakeholders, including the private sector, civil society, and ASEAN external partners. Most importantly, it needs to focus on actionable, impactful measures on strengthening our health system, making trade easier, restoring jobs, accelerating digitalization, and help small businesses and vulnerable sectors to survive the pandemic and its aftermath.
If you look at the outlook, the number that Dr. Jokowi mentioned was 4.9%, but our World Bank global economic projections actually is projecting the deep global recession that we're going to all face at minus 5.2%. And it can be a higher contraction, close to 8%, if the pandemic lasts longer and there's a longer period of shutdown. The range for the ASEAN economies is what I have posted here on the table, and it goes from very low positive to contraction and major contraction in the period when we have longer contraction, longer lockdown. So I think the story of recovery and rebound, well, there is some expectation that there will be positive rebound. We have to remember that the contraction means that you are looking at a lower GDP per capita, and getting back to GDP per capita pre-crisis will still take a few years. And so what I want to emphasize here is that there's a high level of uncertainty with any projection, with a potential longer protracted impact from the pandemic, precautionary consumption behavior that's going to last longer, and low investment confidence, which will put us in a very low growth period for longer. And so I just want to put that as a context, because this is important for us in understanding what we need to do in now as well as in the recovery. We need to be very cognizant of the various impacts that's happening across the world and also in ASEAN. How the COVID-19 has had an impact disproportionately on the poor and on the informal sector and the micro and small, medium-sized enterprises. Women are more impacted because of the loss of income from the informal and services sector and bear the burden of care in lockdown. Children are not going to school and not going back to school potentially even after recovery and after opening up. And this will have short-term and longer-term impact on human capital.
Various partners and stakeholders, as well as the general public, participated in this high-level dialogue and contributed their insights as ASEAN progresses with the development of the ASEAN Comprehensive Recovery Framework. And here is Mr. Ahmed M. Saeed, the Vice President, Operations 2 of the Asian Development Bank, highlighting the policy priorities and strategies to mitigate the impact of the pandemic. Let's listen in again.
Ladies and gentlemen, COVID-19 has also affected the work of ASEAN. While digital technologies have to an extent help us progress our work, they cannot fully substitute the people-to-people connection that is at the core of our community. While we may not know when we can successfully
ASEAN in Focus, we'll be right back.
The biggest and widest talent competition in Philippine television continues with over 7 million pesos in cash prizes. Tagisan ng Galing Part 2. 3 winners will be chosen in each category. Singing category, second runner-up will receive 500,000 pesos. First runner-up will receive 1 million pesos. And for the grand champion, 2 million pesos. Dance category, second runner-up will receive 500,000 pesos. First runner-up will receive 1 million pesos. And for the grand champion, 2 million pesos. Audition now. Send your 3-minute performance video to tagisananggaling@gmail.com. For inquiries, call Nikki at 0977-651-9504 or 8784-7450, local 1363. Shane at 0995-880-8004 or 8784-7450, local 1415. Don't forget to like and follow Tagisan ng Galing's Facebook fan page and subscribe to Tagisan ng Galing's YouTube channel for more announcements. Tagisan ng Galing Part 2 is presented by Eagle Broadcasting Corporation and Net25.
The risk of COVID-19 infection from breastfeeding is negligible and has never been documented, according to the World Health Organization, in a call for greater support for the practice. Take a listen.
WHO has been very clear in its recommendations to say absolutely breastfeeding should continue. These are new mothers that they should initiate early, have their babies skin to skin with them, room in with them. There really should be no change from our standard recommendations. The reason for that is that the risks of transmission of the COVID-19 virus from a COVID-positive mother to her baby seem to be extremely low. The interruption of services has been tremendous around the world for providing the kind of support that mothers normally would get with breastfeeding. Oftentimes, the health services that would provide maternal and child health have been diverted to take care of the COVID response. Sometimes families do not feel comfortable in going into health services because they're afraid that they might get COVID, and so they don't come for a routine kinds of support. We have never documented anywhere around the world any transmission through breast milk. We have tested the breast milk of many mothers around the world in a variety of different studies. And while a few studies have found a few select kind of random odd samples that have had particles of the virus in them, so they've tested positive, when they followed up to see whether the virus was actually viable and could be infective, they could not find any actual infective virus. We have documented through modeling that about 820,000 children's lives are lost every year because of the lack of breastfeeding, and that economically there are losses of about $300 billion per year in economic productivity lost because of the lack of breastfeeding. Breastfeeding provides benefits during the time of breastfeeding, and those are what are kind of most recognized. So protection against diarrhea, which is one of the top causes of mortality in low-income countries, protection against respiratory infections, against obesity, childhood obesity later on as the children get older, protection against leukemia. in addition, breastfeeding protects the mother against breast cancer, ovarian cancer, and type 2 diabetes later on. So there are benefits for both the mother and the baby. And when we've added these up, it comes out to about 820,000 lives around the world, even in high-income countries.
And that is the latest news in the Southeast Asian nations. Stay updated about the ASEAN region. I'm Alma Angeles. We live in interesting times.